Back with Dr. Brian Richardson this morning. We're taking your healthcare questions right now. Give us a call. The number, it's going to be on your screen, 1-800-504-4084 or 420-TALK. Very interesting topic. Alabama #1 in opioid addiction, and something we were just talking about, being addicted to pain pills, which are opioids, is essentially the same as being addicted to heroin.
It's the exact same thing. Same type of medication. Wow. One is in a pill form, written on a prescription. One is obtained on the street or somewhere illegally.
Wow. Okay. So you said there are people who, get addicted to the pain pills, and then they can't get them anymore, and then they'll actually move on to the street version.
Yep. So sometimes it's easier to get it, and and once your body obtains that physiological addiction, where you have to have it. If you don't get it, you're going to go through these terrible withdrawal symptoms. People will seek that out however they can get it, and if they can't get it through medical supervision, then they're going to go to the next available place.
Okay. So what is the next step if you think you may have a pain pill addiction, or you know someone who may have a pain pill addiction? Rehab?
Definitely. So you cannot, if you're addicted to pain medication, you cannot just suddenly stop it. You will die.
It's similar to alcoholism.
Very similar to alcoholism. The results are very, your body goes through all sorts of changes, fever, shakes and chills, and it becomes very life-threatening. So if you've accumulated that physiological addiction, you have to seek medical help to be able to wean yourself off of it.
Okay. All right. And we've got a question here. You're on the line with Dr. Richardson. You have a question for him? Can you hear us?
Yes, sir. Yes, ma'am. Am I on?
Go ahead.
Oh, okay. I am on the air.
You are. Go ahead with your question.
Okay. My question to Dr. Richardson. Dr. Richardson, many of us are older patients that take these medicines and live with chronic pain.
Right.
And we take these responsibly. We take these as they're prescribed. We don't do the things that you're talking about.
Right.
What about those of us that are getting put out in the rain, that need these medicines for a better quality of life, that have done rugged jobs for 30, 40 years and are now suffering the effects of those jobs?
Right.
What about those of us that do things the right way?
Right.
And you doctors are now coming back on us and saying, we're going to not give you your medicine that gives us a better quality of life. Yeah. There's some of us that have to have these medicines just to get out and cut the yard, doctor.
Yeah, that's a good question, and they're the select few that ruin it for the others.
Right, right. So, and again, this is what we're talking about is the abuse of opioids, and there are certainly circumstances where people need pain medication. However, there are other alternatives to opioids, right? So there are medications, there are topical therapies, aromatherapy, acupuncture, chiropractors.
Do those work as well
as
the opioids do?
Actually, and there's studies that show it. And so, the efficacy of opioid-induced, pain relief has not improved. And so there's actually a doctor up in Birmingham who's currently working on getting better opioids that actually don't cause that euphoria, which won't give you that physiological addiction.
But still helps the pain.
But still helps the pain.
Because I can understand his frustration,
right.
that he's probably having trouble getting those prescriptions now, and he's actually someone who uses them responsibly.
Yeah, and again, don't think that doctors are not the bad people in this, and nor are the patients. So it's a problem that we have to all address together. We're not trying to withhold or create pain. Certainly, our job is to help with pain. But on the flip side of that, that is an easily abused medication.
Right.
And 5,000 Alabamians since 2006 have died of opioid induced side effects. And so, it's something that, in the responsible situation, in the right circumstance, yes, opioids are a great pain medication. But we have to look and see at the entire picture and make sure that what we're doing is actually delivering safe care.
It's a hard place to be, and I respect you for having responsibility with it. Thank you so much for being here this morning. We appreciate it very much.
Pleasure.
Still to come on CBS 8 and ABC Montgomery, Jerry Howell has a look at your traffic, and you can find out if you're today's lucky birthday winner.